thank you for coming to talk to us a little bit about home health care. And I was hoping you could define what home health care really is.
Thanks for meeting with me and to talk about my favorite topic, which is home health care. So as a family doctor and geriatrician, one of the most important things for me is how do you help people stay healthy at home, particularly as they age or maybe have chronic illness. And home health care are all the services and supports that might be available to help somebody at home. So this includes nursing care, home health aid services, sometimes more telehealth or telemedicine at home is part of what we would now consider home health care.
Well, we're going to talk a little bit about aging at home, and I think that is a difficult conversation to start with your parents. How would you tell a parent and child to have that conversation about defining what they want?
Sure. These conversations in families are always difficult, right, around sensitive topics around aging and living arrangements and safety. I think, making sure that your parents know that you love them, that this is about their comfort and independence, and that you want to plan ahead for a bad day so that decisions aren't made in crisis, things are set up in advance.
So what kind of information should we be prepared to talk about when opening that conversation?
I think some of the important things are around decision making. So who's going to make which types of decisions if their loved one were to become incapacitated in some way or to have difficulty with memory or for some other reason can't make decisions for themselves. And we call that sometimes surrogate decision making or proxy decision making, but that's really important.
And more people are able to stay at home as opposed to going to a skilled nursing facility or a nursing home. What has improved so that parents are, or those who are aging are, able to stay at home?
One of the most rewarding parts about my work in geriatric medicine and also with Visiting Nurse Association is that we're able to help so many people stay home. Even when they have serious medical issues, even with Alzheimer's disease or Parkinson's disease or other serious conditions, almost everyone can stay home with home care supports if they plan ahead. The services that are available at home are quite robust. I mean, nurses with special training in a whole variety of medical issues, personal care supports like home health aides and other personal care services. These are a really strong set of supports that can be brought to bear to help somebody stay home.
So you're somebody who has witnessed this, who has been involved in going into homes yourself. Is there any type of best case scenario that you have seen or a certain model that might really work?
I've fortunately been able to see many success stories, and they start typically with planning ahead so that it's clear what roles different family members are playing. Often it involves home modification, safety measures around things like the showers in the bathrooms where falls can happen if they're not set up appropriately. Even the basics like lighting and other safety measures being taken into account.
If somebody came to you and said, listen, I've got a parent, they're aging, I don't know what to do.
If they're even thinking about it and having the conversation, they're way ahead of the game. It can be difficult, and it's just always exciting and encouraging to hear families having the conversation in a proactive way rather than in a crisis. Because a lot of times these conversations only happen when mom or dad's in the emergency room and the doctors are saying they're not sure if it's safe to send them home. And that's not when you want to have these type of planning sessions.
I thought it was really interesting. Someone, when I turned 50, a financial planner was saying, you think about saving for college, saving for retirement, but not necessarily saving for home health care. What is that first step, would you say?
I think that if somebody needs help, imminently needs help, calling the Visiting Nurse Association is a great place to start. Our care coordinators, our nurse outreach liaisons will be a wonderful resource for families. If you're not sure in your community where to call, you can also call your area agencies on aging. So these are funded through the Older Americans Act through the federal government. There's in every county and region an area agency on aging where people can reach out to ask for support.